I'm Dr. Divya Lakshmi, and I'm an associate professor in the Department of Ophthalmology. I'm a cataract surgeon and as well a vitreoretinal surgeon, and I practice in Bangalore. Today, we'll be discussing something about what is known as computer vision syndrome. What is this? Over the last 20, 30 years, we have seen a major leap in the field of information technology with the introduction of computers, right? There has been a major advancement in the field of IT. Computers have become an indispensable part of our life, both at office and even at home. And with the global COVID pandemic, all of us have been restricted to our houses. And this concept of work from home has started. Even our kids, they are forced to sit in front of the monitors. They are made to sit in front of a computer for hours together in the name of online classes. So the screen time has majorly increased in the last year or so because of this global pandemic, worldwide lockdown, and the screen time has increased. With the introduction of computers and digital gadgets, no doubt we have seen it has revolutionized majorly and it has benefited our society in many ways, but it has its own downside. It has affected the health, and there are health related issues related to the gadgets. Apart from the routine musculoskeletal complaints like tingling sensation, numbness of the fingers, neck pain, back pain because of prolonged usage of working on computers, we have also noted an increasing trend with respect to eye-related complaints. The eye-related complaints have become more frequent in the population, especially in the last 2 years because of, say again, the global pandemic. The terminology which is given to this particular condition is called as computer vision syndrome. So what is computer vision syndrome? It is a complex of eye problems and vision problems in relation to the use of computers. In simple terms, we can put it like this. What are the common complaints we see in person having a computer vision syndrome? The common ones are eye strain. A person feels that the eyes are becoming more heavy. They feel there is something sitting on their eyes, a heaviness in the eyes. They may have watering. They may feel the eyes are becoming red because of the constant, after working for long hours on the computers, they feel their eyes have become red. They have some irritation in the eyes. They may feel there is something like a foreign body sitting inside the eye, that is like a foreign body sensation. And some of them may have some extremes like blurring of vision or even double vision. So these are the common symptoms that people do face. Most of these symptoms are usually temporary. That is, once the screen time is over, all of this disappear. Then it may not continue after some time. Once the screen time is done, once they finish with their work, once they shut down their computers, all the symptoms disappear. But if not intervened at the early stage, or if it is neglected, these things can recur and it may also worsen over a period of time. Why does this happen? Why? What are the mechanisms? There are many mechanisms which can cause this particular condition, that is a computer vision syndrome. The common mechanisms are, what happens when we are looking at a screen or a monitor for a long period of time? We forget to blink. So we are concentrating so much on the work there that we forget to blink. This reduced blink rate causes dryness of the surface, that is both the ocular surface, the eye surface. And this causes all these complaints of straining, dryness, and then foreign body sensation. All this happens because of dryness, that is mainly because of reduced blink rate. Not only that, the visual demand is also more. When we are working on a computer, the visual demand is more. Why? Because of the low resolution. The resolution is so less on the computers, it affects the contrast, and it also has this glare component. The computers have this, the glaring of the computers also add up to all this, and it causes a discomfort. So how do we prevent this? It is always better to prevent, right? So what can we do? Do some environmental modifications as well as personal modifications. What environmental modifications can we do? Avoid improper lighting in the room. Proper lighting conditions have to be maintained. Not too much of bright light, not too much of dim light. Lighting has to be adequate. There should not be light falling on the screen. It can cause glare again. Adequate filters have to be set in the computer screen, or probably even the person who is using the computers for a long period of time may go for a protective eyewear which has filter in that. Also, the distance between the eye and the screen has to be maintained. A minimum of 35 to 40 inches have to be maintained between the eye and the screen. And also, it should be below the eye level. It should not be, try to maintain the screen below the eye level. Take breaks in between. Do not do the work continuously. Take at least a break at least once in 15 to 20 minutes. Take a break, stretch, or have a snack, do whatever, but take a break from looking at the screen continuously. Blink. And if all these are not working fine, go for eye drops. There are good number of eye drops available. They're available over the counter, even in any medical shop. And you start using the eye drops to prevent the dryness happening. If the problems are because of a refractive error, that means a person is having some amount of refractive error, that means they need glasses, a corrective glass. Please visit an ophthalmologist and get the corrective glasses done. Also see an ophthalmologist if all these are not, the symptoms are not coming down in spite of the protection or the precautions being taken. The computers, electronic gadgets, they're all here to stay. They will be there. They will come with us. They're there to stay. So it is inevitable. The computer vision syndrome is inevitable. We have to deal with it. So what do we do? Be careful, try to prevent it by taking all these measures. But if it has already set in, go treat at the earliest. Visit an ophthalmologist and take the adequate treatment and feel good about it.